For full prescribing information regarding Arista AH, Flexitip, or Flexitip XL Extended Reach Applicator tips, including indications, administration, and any relevant contraindications, warnings, precautions, or adverse reactions, please view the information included at the end of this animation, as well as the complete instructions for use included with each product. Arista AH is indicated in surgical procedures, except neurological and ophthalmic, as an adjunctive hemostatic device to assist when control of capillary, venous, and arteriolar bleeding by pressure, ligature, and other conventional procedures is ineffective or impractical. Arista AH is a sterile, absorbable hemostatic powder consisting of microporous polysaccharide hemispheres, MPH. The patented clotting technology is derived from purified plant starch. Using Arista AH is simple. First, remove any excess blood using suction or gauze. Then apply Arista AH liberally to the wound site. Hold wound-appropriate pressure over the treated site. Irrigate excess Arista AH from the wound site. When applied directly to the source of bleeding, Arista AH works as a molecular sieve. On contact, Arista AH immediately starts dehydrating the blood to form a gelled matrix. The osmotic action concentrates serum proteins, platelets, and other formed elements on the surface of the Arista AH bead. The particles and their coating of compacted cells create a scaffolding for the formation of a strong fibrin clot within just minutes of application. Hemostasis is achieved quickly, safely, and effectively. The Arista AH particles are fully absorbed and enzymatically cleared from the wound site within 24 to 48 hours, versus some other surgical hemostats, which can take as long as 6 weeks to be reabsorbed. Arista AH with MPH technology is a simple, safe, and effective alternative to thrombin-containing absorbable hemostats. The plant-based, fast-absorbing product is the latest generation in hemostasis. Indications. Arista AH is indicated in surgical procedures, except neurological and ophthalmic, as an adjunctive hemostatic device to assist when control of capillary, venous, and arteriolar bleeding by pressure, ligature, and other conventional procedures is ineffective or impractical. Federal USA law restricts this device to sale by or on order of a licensed physician or properly licensed practitioner. Contraindications. Do not inject or place Arista AH into blood vessels, as potential for embolization and death may exist. Warnings. Arista AH is not intended as a substitute for meticulous surgical technique and the proper application of ligatures or other conventional procedures for hemostasis. Once hemostasis is achieved, excess Arista AH should be removed from the site of application by irrigation and aspiration, particularly when used in and around foramina of bone, areas of bony confine, the spinal cord, and/or the optic nerve and chiasm. Arista AH swells to its maximum volume immediately upon contact with blood or other fluids. Dry, white Arista AH should be removed. The possibility of the product interfering with normal function and/or causing compression necrosis of surrounding tissues due to swelling is reduced by removal of excess dry material. Safety and effectiveness of Arista AH have not been clinically evaluated in children and pregnant women. Because there have been reports of decreased amylase activity in newborns up to 10 months, absorption rates of Arista AH in this population may be longer than 48 hours. Arista AH should be used with caution in the presence of infection or in contaminated areas of the body. If signs of infection or abscess develop where Arista AH has been applied, reoperation may be necessary in order to allow drainage. Safety and effectiveness in neurosurgical and ophthalmic procedures has not been established. Arista AH should not be used for controlling postpartum bleeding or menorrhagia. Precautions. When arista AH is used in conjunction with autologous blood salvage circuits, carefully follow instructions in the administration section regarding proper filtration and cell washing. Arista AH is intended to be used in a dry state. Contact with saline or antibiotic solutions prior to achieving hemostasis will result in loss of hemostatic potential. Arista AH is not recommended for the primary treatment of coagulation disorders. No testing has been performed on the use of arista AH on bone surfaces to which prosthetic materials are to be attached with adhesives and is therefore not recommended. Arista AH is supplied as a sterile product and cannot be re-sterilized. Unused open containers of arista AH should be discarded. Do not apply more than 50 grams of arista AH in diabetic patients, as it has been calculated that amounts in excess of 50 grams could affect the glucose load. In urological procedures, arista AH should not be left in the renal pelvis or ureters to eliminate the potential foci for calculus formation. Adverse reactions. None of the adverse events that occurred in a randomized, prospective, concurrently controlled clinical trial were judged by the Data Safety Monitoring Board to be related to the use of arista AH. The most common recorded adverse events were pain related to surgery, anemia, nausea, lab values out of normal range, arrhythmia, constipation, respiratory dysfunction, and hypertension, all reported in greater than 10% of the arista AH treated patients. The details of this clinical trial's adverse events can be reviewed in the IFU supplied with the product and are also available at www.davol.com.